talk about fat grafting, what exactly it is.
Yeah, what is it? Well, it's taking fat from where we don't want it.
And putting it where we do.
And putting it in a place where we're going to like it.
Sounds simple enough,
yeah,
right?
In my mind, it's really about the curves. You know, this is a pretty good example.
Oh, yeah.
This is a patient where I've done fat grafting. And, you know, if we look ahead of time here, we look at this picture on the left, kind of a square shape. High hips and flat to the outside and not a lot of volume here in the buttock overall. So I've done liposuction, you know, to show off the figure.
Just completely changed her
Bring
shape.
the waistline, but then adding. Adding is to get the curve. So, you know, we're going for more of that hourglass figure from where we started. That's what it's all about, really. And to me, this is where body contouring is advanced to, is to where we're showing off the figure all the way around.
Exactly.
Not just removing the loose stuff, maybe not just removing the area where there's a little extra, but really how are we showing off the figure. And it's not just for patients that have a BMI above 25. It can be for thinner patients. Here's 2 thinner patients before and after. We're liposuction all the way around, showing off the waistline, you know, where we have less curves in the back and a little extra fat, little fat rolls, and working to show off more of a figure. Not everybody in my practice, in fact, it's a minority in my practice that actually want a truly bigger butt.
Yeah, yeah. Some people want to be a little more conservative.
Yeah, and I'm in Colorado, right?
Exactly.
I mean, and so not everybody wants that. We see those patients, but it's different probably than a surgeon who may be in Miami or Dallas or in LA where there's a dominant goal for that. I think it's great both ways.
Oh yeah, for sure.
But there's a whole range of patients' goals. Patient on the right, same thing, you know, fairly flat overall, working to bring things in the waistline, this whole transition zone of shaping or framing of the upper buttock, and then adding some curve to the buttock overall.
And it really looks like a nice natural transition as well. It's not just an abrupt, they call it a diaper booty, I guess. Kind of like, I hate to pick on Kim K again, but kind of it just sits outside of your body and it doesn't give you that natural appearance of that natural curve.
So body lift, that has a scar that's going to come all along here. In fact, you can see parts of it on her post-op picture. And we're working to elevate, and that's helped a lot here with the wrinkles. You can see they're still there, but dramatically better. But the volume,
just
adding the volume to the buttock where it was super flat. And let me clear all this stuff out. Adding the volume where it was flat here, giving some fullness and curve, even with body lift, is really an integral part of body lift for me.
Oh yeah.
And I find it super, super helpful.
Yeah. Not only do they get their extra skin removed, but they really have the fullness and volume in their bottom, and the whole body just comes together. So definitely an awesome addition for someone who's gone through such a dramatic change.
Hi, Denver Body Co. I was wondering, I was looking into getting a Brazilian butt lift, and I was wondering if you need to have a certain BMI to be able to qualify for a Brazilian butt lift, and if so, what range of BMI are you looking for? Thanks.
What BMI? It's a great question.
Especially with the last one.
Yeah, off the top. So I would say, you know, in general, 20 to 30, right? That's a huge range.
Yeah.
I've had thinner patients that are BMI 20, sometimes a little bit below. And when we're doing a patient that's very thin, and they might have just a couple little problem areas that I wouldn't see as problem areas, honestly, but they are seeking to have a thinner, leaner trunk appearance. That is a patient that I would say, why don't we take that fat, as little as it is, and go ahead and use it for boosting the curve in the buttock. If for nothing else, giving, you know, restoring some youthful inflation of the buttock, where over time, we're all going to shrivel up like a raisin, okay? Our cheeks shrivel up on our face, our cheeks shrivel up on our buttock, and we don't want to be that little old man, little old woman buttock. It is basically going back to restoring fullness of the buttock.
Hi, Dr. Nick. I've got a question. How long do Brazilian butt lifts last? And what happens when you work out the area after you get the operation?
Okay, how long does it last? This is a great question. It lasts a long time. Okay, what doesn't happen is you don't wake up and boom, that fat is gone. That's not something that we see. It may resorb slightly. Most of that resorption is going to be in the healing period. It means it never takes. When the fat takes, what's happening physiologically is your body is reabsorbing or readopting that fat in the new location. It's transplanted. It gets new blood supply from the surrounding tissues, and now it lives as long-term fat in that area. One of those safety factors is don't overfill to the point where things are overly rigid, and that is an important measure. So there are cases where we may do it in 2 separate procedures, and I've had patients over the years that have come back and say, hey, you know, my body status has changed. I want to see if we can do more, if there's fat available. There have been those cases, and I've done a number of patients that have come and said they've had a BBL done. yet they still wanted more. And I'll look and examine them, and some I'll say, wow, I can do a lot to shape more, even in the back and the framing of the buttock area. Absolutely. Others that may not be the case. So that's going to be very individual per the patient.
Going off of that and going off of recovery, 1,000,005 questions about the black and the blue butt cheeks. When does that go away? Is it as painful as it looks? A lot of people just see those after pictures and it's the most perfect round bottom ever, but it just looks like it just was in the boxing ring. So tell us a little bit about that recovery time.
Certainly. We show these patients, and we show patients that are wanting to be on our social media at follow-up, even the day after or weeks after, and no question there's often bruising, in those early days and weeks. Usually by 6 weeks, just about all that is resolved. It will vary. It's uncommon that bruising would cause any long-term issues whatsoever. So it's a matter of timing on that. Generally by 6 weeks, and almost always by the time we get to 8 to 12 weeks, we're going to have that bruising be resolved. We appreciate you joining us. Plastic surgery, again, it's not for everyone, and it's never the destination. It certainly can be part of the journey for many. And we always believe in that kind of power of self-improvement and working to be your personal best. Please send in your questions. We'll definitely respond. Good night for us. Enjoy your journey.